When getting a tracheostomy tube and/or a ventilator, it can be overwhelming trying to figure out which medical supplies you need and which supplies you do not need. Furthermore, it can be very confusing if your medical equipment company is going to be supplying those supplies or if you're required to purchase them on your own. So join me this week as I go through some of the supplies you're going to need with having a tracheostomy tube and/or ventilator. First of all, when getting a tracheostomy tube, one of the very first things you should get is a tracheostomy tube the same size as your own tracheostomy tube. Right here, I have the tracheostomy tube that's the same size as my tracheostomy tube, and I keep this on hand wherever I go. If I travel, if I go anywhere, I always bring a spare tracheostomy tube with me because you never know when an emergency might arise and you're going to need to change out your tracheostomy tube. So this is the very first thing you're going to need is a tracheostomy tube the exact same size as the tracheostomy tube you're currently wearing. The other thing you're going to need, this is a tracheostomy tube, which is one size smaller. So I'm going to show you. Here are the two tracheostomy tubes. This is the one I use. It's 5CN70H, and this is one size smaller, which is 4CN75H. So I'm going to keep this one on hand, and it's important to have a tracheostomy tube which is one size smaller than the one you currently use, simply because if you do a tracheostomy tube exchange, it can happen that for some reason you can't get the larger size tracheostomy tube or the tracheostomy tube size you're currently wearing. You can't get that into your tracheostomy site. It does happen. If that becomes an issue and you just can't get the tracheostomy tube in, you switch and try to use a smaller size tracheostomy tube. Hopefully you're able to get the smaller size tracheostomy tube in place. Once you get it in place, it gives you time to call either your respiratory therapist, perhaps your medical doctor, or if you need to go to the emergency department so they can get into place the correct size tracheostomy tube. So you should always have two tracheostomy tubes. I don't necessarily bring the smaller size tracheostomy tube wherever I go. I have not had an issue about not being able to get my regular size tracheostomy tube into my tracheostomy tube hole. I've had my tracheostomy tube for over 8 years, so I feel very confident about just bringing one tracheostomy tube, the correct size, with me. But if it's a brand new tracheostomy site, you probably want to have the smaller size tracheostomy tube with you wherever you go, because with a fresh tracheostomy site, they do have a tendency to close up fairly quickly. So if you're slow trying to get the new tracheostomy tube in place, or for whatever reason, it just closes up very, very quickly, you can always switch to a smaller size tracheostomy tube. However, if you've had your tracheostomy tube for a number of years, the risk of it closing up very quickly is much smaller, and it's probably not going to be a big deal if you just have the same size tracheostomy tube on hand and don't have both of them. But if you're getting a new tracheostomy tube, please have the correct size and then one size smaller. The other thing you're going to need is you're going to have lubricant jelly. Lubricant jelly is essential to get your tracheostomy tube in place. Lubricant jelly can come in one of two forms. First of all, you can actually just buy the lubricant jelly from your pharmacy or from Walmart or wherever you like to purchase these goods. You can buy that there. My medical equipment company does not provide lubricant jelly, so I found this personal lubricant jelly from Walmart. It's the Equate brand. It works. You just have to open it up. Unfortunately, this is just a big size, so whenever you use this, you're going to open it up and you're going to have to disinfect the top of it every time you're going to use it. It's a little bit of an inconvenience if you're on the road and you just need something quick. However, some medical equipment companies provide lubricant jelly that comes in these little packets here. They are different forms. I'm going to show you a couple different variations of them. So some of them look like this, just Premier Pro. Some of them look like from Medline, like this. So there's different variations, but they're just these little packets and they're a one-time use. You're going to rip open the top of this, pour that on your tracheostomy tube, and then whatever you don't use in the packet, you just throw away, and that's it. Unfortunately, my medical equipment company does not supply these, so I need to pick these up whenever I'm at the hospital. I always kind of think this is like my emergency stash. I bring this with me whenever I travel because it's very convenient to change out a tracheostomy tube using one of these little packets. However, when I'm at home, I almost always use just this other lubricant jelly because I don't have a lot of these. I've tried looking to purchase these online, and unfortunately, you have to buy an entire case or 144 of those, and that just seems like a lot of lubricant jelly. So I just picked these up at the hospital and use those sparingly. The next thing you're going to want is a tracheostomy tube holder or tracheostomy tube ties. Now this is a tracheostomy tube holder. I'll open this up for you. It's what I'm using right here. Let's open this up. Oh, okay, so this just has the Velcro like this, and you're able to get it to different sizes and then adjust and get it around your neck and make it whatever size you want. And it just uses Velcro. And then you cut this down. I show it in a different video how to use this more specifically. The other thing you can use are these ties. I don't like these ties because it requires a lot of effort to get these little knots, and you have to get them on your tracheostomy tube at the end here. I can show you with this. Or not. There you go. I can show you with this tracheostomy tube. So you're going to have to get these ends into these holes like this. It's kind of tricky. Yeah, I'm not very good at it. So you're going to have to get, there we go, going to do that and going to have to tie it. Some medical equipment companies do not provide these. You can purchase them online. They're about $2 each, or you can get these ties. These ties in most tracheostomy tubes, let me show you in this one. For example, I don't know if you can see, there's a little bit of this tie in there. Anyways, it's in the Shileys. It's in a lot of tracheostomy tubes have the ties in there. So if you're changing out your tracheostomy tube, you can just use these ties, but I much prefer these tracheostomy tube holders. If you have a child, for example, an infant or somebody that's pulling at the tracheostomy tube, these are not going to work very well because they're going to pull on them and they're going to fall off, and then you can actually lose your tracheostomy tube if the child pulls on it. Many parents prefer these because you can tie them, and then little fingers have a really hard time getting these knots out, and it's much harder. And if this will go around the neck, and if you're pulling on it, this is hard, really hard to undo. So some parents like to use this. Some adults like to use this because it's much less likely to detach. But these are much easier. These are much more comfortable. This is a padded fabric, and it's just much more comfortable. I do not like these at all, but you can use whatever you'd like. The next thing you're going to want is a tracheostomy tube obturator. Most of the time these obturators are included. You can see this is included with the packaging with the regular tracheostomy tube. You absolutely need an obturator when inserting a tracheostomy tube. And as far as I know, every single tracheostomy tube brand that I've ever encountered always has an obturator in here. The obturators don't always look like this, or sometimes look a little bit different, but I'm going to show you this is why you need an obturator, because you're going to put the obturator into the tracheostomy tube. This provides a smooth rounded tip, and now you're going to be able to insert the tracheostomy tube. I always carry around extra obturators. I sterilize these. I put these in boiling hot water, and then I carefully use sterile tongs, put this on paper towel, let it dry, and then wrap it in clean paper towel, put it in a plastic bag, and then take that with me wherever I go. Why? This obturator is so critical. If your tracheostomy tube, for whatever reason, falls out, and I had that happen once, my Velcro actually got snagged when I was changing out a shirt, and then my tracheostomy tube fell out. Inconvenient. But what was not inconvenient is I had an obturator with me. So the tracheostomy tube fell out. Not very good. Actually, I caught it barely just on the top here. I was able to put a tracheostomy tube obturator in, got some lubricant jelly, and put it back into my airway. That really saved my life. Also, this obturator can be used if the tracheostomy tube gets clogged. You can use this to get rid of the mucus clog. These obturators are really, really essential, and I beg you and implore you, please always have one with you. Have a clean one that's clean, wrapped up into clean tissue or whatever, and bring this with you wherever, because you never know when you might need an obturator. You never know when your tracheostomy tube might fall out or it gets clogged and you need to clear the airway. Another thing you might use when you have a tracheostomy tube are inner cannulas. For the shyly flexible tracheostomy tubes, these are the inner cannulas. They're little pieces of plastic and they fit into the airway. I'll show you here. So they just fit right in here to the airway, and this acts as a liner. Mucus collects on this inner cannula, and then you can easily just take it out. You can wash this and then insert a clean inner cannula into the airway and then go on your day. Some people do not use inner cannulas, so if you don't have an inner cannula with your tracheostomy tube, don't worry. Some people don't use those. Some tracheostomy tubes, such as the Bivona, a lot of those do not have inner cannulas. So don't be afraid or freak out if you're like, oh, mine doesn't have an inner cannula. This is just an extra. A lot of people who first get tracheostomy tubes like inner cannulas because you have a lot of mucus, and this really saves you from trying to get out a mucus plug. You just pull out the inner cannula, put in a new inner cannula, and voila, you get rid of the mucus plug. And then you can clean these and then sterilize them and reuse them. That brings me to another thing your medical equipment company may or may not include. That is a tracheostomy clean and care tray. This is what the one I was given looks like, and this is actually the original shipment I was given way back in 2017. I don't use these. I'll show you what's inside. So the inside, it's just this care tray, and there's more of this whatever. Tracheostomy ties. Ah, yes, that's what it's called. There is a scrubber. This scrubber can clean either the inside of these inner cannulas, so you can use it to get rid of the mucus and then discard this if you want. I actually wash and sterilize these because these are really excellent brushes. I use them to clean out different things, different tracheostomy related things. So I use these. The other thing that's included is like a sterile mat. So very carefully, you can open this up, and then this becomes a sterile mat that you can put things on that you don't have to worry about getting things contaminated. Also inside this kit are tweezers. Yay, tweezers. I'm not sure what this is. I've never figured out what this is. They're like pipe cleaners. I'm not even sure. They give you two of them, but I guess they have a function. If you know what the function are for these, let me know, because I personally have just used these in arts and crafts, and I don't know what they're used for. The other thing that are used in here are these long-tipped Q-tips. And so these long-tipped Q-tips are good for if you need to, clean in here, you can get in and clean these instead of using the brush. You can clean the outside. These are really, really nice. I also use these when you're cleaning, if you have to clean and reuse a tracheostomy tube. They really do a nice job getting down here, getting down where the cuff is. These do really, really nice job, and they kind of get up in there. I like these long tip Q-tips, but again, you can actually buy these if you want. This tray also has inside, so it has this top tray where all the supplies were, and you can lift this off. And then voila, there is a tray inside here, and that's where you can actually clean your inner cannula if you want. You can put this in here and rub-a-dub-dub, you got a clean tub. You can use that. I know, it's lovely, it's nice. I think there's even two tubs. Yeah, there's actually two tubs in here. So it provides a lot of useful things, but quite frankly, I mean, what can you do? I don't know. Some people like having all this stuff and then just throwing it out. I love the environment a lot, so I try not to use these and dispose of them. You can use one of these every single day. My medical equipment company was giving one to me for every single day to clean and wash my inner cannulas. I just thought this was so wasteful. I just use a clean glass container that I have. I put it in the dishwasher, wash it, and just keep using it. I think that's a better use, but if you want, you can get these. They are provided by a lot of durable medical equipment companies. They're nice. Yeah, you got everything all in a little cute little kit. And maybe if you just first get a tracheostomy tube, this might be really, really useful. But after a while, like I said, I've had my tracheostomy tube for over 8 years. That means I would have had over 3,000 of these kits. That's a lot of kits and a lot of landfill. So do what you want, either get one of these or not, but they're not absolutely essential because it really depends if you have an inner cannula, if you're going to be washing that every day. Some medical equipment companies give you new inner cannulas for every single day. Some don't. Some make you wash and reuse these. So you're going to have to find out through your medical equipment company what they require. The next thing you're going to want are gloves. Now, when you get gloves, some people become absolutely panicked that you need to have sterile gloves. Perhaps for some things, yes. But if you're just changing out a tracheostomy tube or just doing trach care, you can actually use just exam gloves like this. And these exam gloves are actually not sterile. They're for single use only. I think it says right on there, latex free, yes, non-sterile, single use. So you can get these gloves. They don't have to be sterile, like I said, because you're just using clean technique and not sterile technique. When you take gloves out of this box, they're generally clean as long as you're not spitting and doing other stuff into the box. It stays pretty clean. So you just take out gloves, wear them if you need to change out your tracheostomy tube, and then discard them. So I encourage you to get gloves if you're doing any sort of trach care and mucus is nasty. And yeah, wear gloves. It saves you from getting mucus all over. The next thing you may want to use is called split gauze. This gauze goes around the tracheostomy tube. I personally do not use the split gauze. I find the gauze really irritates my skin. However, especially after you first get a tracheostomy tube, you might want to put that split gauze around because your tracheostomy site generally has a lot of discharge. Having that split gauze around there is going to absorb the moisture. It's going to help keep that area dry, and you're just going to change out the split gauze as often as needed. Probably once a day, but when you first get your tracheostomy tube, you're probably going to want to change it in the morning and then in the evening before going to bed. The next thing I have is a suction machine. Here's my suction machine. Let me explain a little bit about the suction machine. First of all, you're going to need suction catheters. And let me break right here. If you don't use suction, don't worry about this. Some people with tracheostomy tubes don't use suction. I personally do not use suction, but that's a video for another day. However, when you first get your tracheostomy tube, you're probably going to want to use suction, and you're probably going to be given a suction machine. So let me run through some of this. First of all, with suction catheters, there are a couple different suction catheters. There are just the regular suction catheters. These are open catheters. And let me show you what I mean by that. These do not have any sort of sleeve around them. And actually, if you're touching this, that's terrible. You should not be touching this with your bare hands. These kits have inside of them, these are sterile gloves. Remember, I was talking about just using regular old gloves are fine. Yes, but not for suctioning. For suctioning, you must use sterile gloves if you're using this open suction catheter. And this open suction catheter, this is going to go down into your airway, and you can't be touching this with your bare hands. You need absolutely sterile procedure. You're going to be using their sterile gloves. So in these suction catheter kits, you're going to have this open suction catheter, sterile gloves, and then this one also has inside, it has sterile water. Wonderful. So this is a type of suction catheter. If you just have a tracheostomy tube, you are probably going to get these catheters. I don't like them because you have to use sterile procedure, and it is really hard once you push this down into your airway and take it out. Yeah, I feel like my gloves are contaminated. I don't care how careful you are doing this. I always feel like my gloves are contaminated, and I'm really nervous once you pull it out. And if you still have mucus, you're going to have to put it back in, and I don't really care for these much. There is another suction catheter you can use, and this is called a sleeved cut suction catheter. So it's a sleeve suction catheter. I'm not going to open this up because I only have one of these, but I'm going to try to let you show here. It actually has a sleeve around the suction catheter. So this means that there's a sleeve. So you're going to hold on to the sleeve and you're going to push the catheter via the sleeve into your tracheostomy tube. These are amazing, and these can be used if you just have a tracheostomy tube. So try really hard to get these sleeved suction catheters. I find they are so much better than just these open catheters. These just lower my anxiety that you're going to accidentally get something into your airway, simply because you're going to be holding on to this exterior sleeve, and that's what you're touching, and this exterior sleeve does not go into your airway. Now, if you have a ventilator, you can have a closed system suction catheter. So that's what this looks like, a closed suction catheter. Again, this has the sleeve. I'm going to open this one up because I do have more of these, so you can see what I'm talking about when I talk about they have a sleeve on them. So if you can see on here, so this is going to attach to your tracheostomy tube, and this other part's going to attach to your tubing. But just to show you how this sleeve works, it's very similar to this one. If you can see, there's a sleeve over the catheter. So that is what you're going to touch, and you're going to push the catheter, and the catheter advances. And please note, this is a really old catheter, so it's discolored. Yours should not be this color. It should be clear. So you can push this in, and that's going to go into the airway. I can quick show you this on a tracheostomy tube. Okay, so here's a tracheostomy tube. You're going to attach like this, and I'm just going to show you. So you're going to push it in and watch. Oh, there's the suction catheter. So it goes through, and you never actually touch the catheter. Oh, these are wonderful. And like I said, these are for this one, because this has the extra port for your ventilator tubing. This is just for the ventilator, but there's ones for just having a tracheostomy tube, and they don't have this extra. It's basically like this, and you pull this out. Oh, these are incredible. If you want, I can quick show you. If you just have an open suction catheter, so you're going to have to thread it through. And like I said, you're going to be touching that, and then you have to pull it out. And this is not clean, and you're going to be touching it perhaps with your sterile gloves. I don't like this system very much. So like I said, this one just is so brilliant because you're just touching this sleeve. You're never touching that catheter. Oh, life is so much better with these sleeved suction catheters. So if you're trying to get suction catheters, go for the sleeved ones. These are wonderful, phenomenal, amazing, life-changing. But I don't suction, but that's for another video. So the other thing you're going to need is actually a suction machine. This is mine. This is what it looks like. There's a couple different parts. There is this part that's going to attach to the end of your suction catheter. So there's this tubing you're going to need, and then also there's going to be this reservoir. This reservoir is going to fill up with not a lot of nice stuff. Mucus, nasty. And then there's also a filter on top here, which looks like this filter. This filter also gets changed out. It's right here. Oh, okay, you can't see that. It's right here on top. That filter. That's what this filter is. Anyways, so you have that too. So you're going to make sure they give you a suction machine. Make sure you have all the parts. Suction machine, tubing, canister, and the filter on top. Yay! Make sure you have all those parts. So, yes, I know, a lot. So this is the suction machine that I was given. It's portable, lovely. It comes in this little bag, and also it has this charger. You can charge it up. When I first got my tracheostomy tube and I was actually using the suction machine, I pretty much kept it charged all the time because I felt like I never knew when I might need it. And if this wasn't charged, then you might take it and it's dead battery. But as I was getting ready to film today, I've had my tracheostomy tube for 8.5 years. And let me tell you, I never looked in the side pocket because there is a charger for in the car. There is the little charger that you can plug in to the well, I call them the cigarette lighter, but I don't think you call those that anymore. But you put it into the thing in your car, and I guess you can charge it that way. 8.5 years, I never knew this was in that side pocket. Things I learned filming a YouTube video. So this is the suction machine. You're probably going to want one when you first get the tracheostomy tube. after some time passes, you might decide suctioning is not for you, or you might want to use a different method. So one other thing you're going to need with your suction machine, let me just put this. Oh, you're going to want these saline bullets. I'm just using this. This is what I received from my tracheostomy or from my medical equipment company. These are little saline bullets. Now you're going to use these a lot. Probably if you suction, you can rip off the top of this and then pour that into your tracheostomy tube, and then you're going to suction. However, you might not ever use these suctioning. Did I ever use these suctioning? Maybe once or twice. But I will tell you what these are wonderful for are your nebulizer. And you say, what's a nebulizer? I'm glad you asked. So every single person, this is just my mantra, every single person that has a tracheostomy tube, please get one of these. These are a nebulizer. These produce like an aerosolized mist. And you can connect this to your tracheostomy tube, breathe it in, and I put saline into this. I can just quick show you. Yep, put saline in here, run the nebulizer, and it adds moisture to my airway. It does an amazing job. This is the best thing I've ever found to get rid of mucus in my tracheostomy tube. It loosens it up. It makes getting rid of the mucus so much easier. Again, that's what I use these little saline bullets for, but I'm going to tell you a little caveat. If you use these saline bullets in your nebulizer, your insurance company might not cover these. So to get these covered by insurance, you might have to say they're used for suctioning. Do what you need to do, but I love these saline bullets. They're very convenient, and you can put them in your pocket. You can put them wherever, and they don't leak. And you can use them either for suctioning or for a nebulizer. Now, coming back to a nebulizer, this is a nebulizer. It's pretty simple. Just, there's this tubing, there's this canister, like this, and then there's a T-adapter. Pretty simple, so it's not really that complex or complicated. People do get different medications through here. People get albuterol. There's some different medications you can get, but I primarily just use this for saline. Wonderful. If you do not get one of these when you first get a tracheostomy tube, please ask for one, because these provide so much moisture. Just running saline through this in the morning and or in the evening helps so much loosen up your secretions, getting them thinner. If you do suction, I often recommend running the nebulizer before suctioning. It gets everything all loosened up, and then you just quick put the suction catheter in and out, and it makes suctioning so much easier. So please, nebulizer. And I also will say, make sure this is called the nebulizer kit. It has the tubing with the canister and then the T-adapter. Most nebulizers, when you buy them or when you get them from your medical equipment company, they will have this all together. But if this gets used or dirty or just doesn't work anymore, you can get a nebulizer kit, and that's just the tubing, the canister, and the T-adapter. You can get that separately, and you can get that, again, most of the time through your medical equipment company. They will happily provide you with a new nebulizer kit. The next thing you might or might not use are these. They're called heat and moisture exchangers. They come in various sizes. Now, if you just have a tracheostomy tube, I highly recommend not leaving the end of your tracheostomy tube open. I'll show you what I mean. I don't recommend keeping it open. Instead, I recommend a couple different things. First of all, if you're not using a speaking valve, I recommend use a heat and moisture exchanger. This is a little device. So this has inside of it either paper or a sponge, and that material inside retains heat and moisture. This is going to do wonders to prevent your airway from getting very cold. It's going to prevent your airway from drying out, and it's very simple. You just put it on the end of your tracheostomy tube, like that, and that's all done. That's all you need. Now, if you have a ventilator, I'm going to say use these heat and moisture exchangers only when you're not attached to your heated humidifier. If you put this on and use your heated humidifier, this is going to get overwhelmed with moisture. It's going to be a source of possible infection because it's just going to be dripping wet, and it can also just start spraying water into your airway. So please do not use this like this and you're attached to a heated humidifier. No, don't do that. And you say, well, when do you use a heat and moisture exchanger? You only use a heat and moisture exchanger when you are not attached to your heated humidifier. So for example, if you're going out on a trip or something, you're going to want to attach a heat and moisture exchanger to your tubing circuit. I'm going to show you. Here's the tubing circuit I use, and you can see I have this. This is a heat and moisture exchanger. It looks like this. It's actually a little bit bigger than the ones they usually use for tracheostomy tubes. Why? Because your ventilator is really pushing air in and out of your airways. You're going to want a bigger reservoir to capture heat and moisture. So usually a bigger heat and moisture exchanger is used for ventilator patients. But this is a heat and moisture exchanger. Please, if you're not using one, please look into using one. This will really save your airway. I mentioned before if you are using a speaking valve. So let me show you. This is just the passing mirror speaking valve. It comes in this package. Inside here is the speaking valve. So the speaking valve, if you're just using a tracheostomy tube, attaches to the end of your tracheostomy tube. Da, 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 da. And this is a speaking valve that allows you to speak without finger occlusion. If you're using a speaking valve, you don't really need a heat and moisture exchanger because the air is coming in, but then the speaking valve is shutting and it's forcing all the air up through your nose and mouth. Your airway doesn't get really that dehydrated. There are special heat and moisture exchangers you can use with the speaking valve. So if you want to, please feel free to do that. But a lot of times people find if they're just using the speaking valve, they don't necessarily need a heat and moisture exchanger. If you're using a speaking valve in line with your ventilator tubing circuit, you're just going to use it in line. I'm not going to really go into details on that. Your respiratory therapist is going to have to show you how to do that and how to make the appropriate setting adjustments on your ventilator. But this is a speaking valve. Not everybody that has a tracheostomy tube or has a tracheostomy tube and ventilator uses a speaking valve. I do not. I find it much more difficult to speak with a speaking valve than not using a speaking valve. So this is kind of an optional thing. If you use it, great. If you don't, no worries. So if they want you to use a speaking valve, please make sure you have one. Not that they say use one and you don't have one. Another thing you might want if you have a tracheostomy tube is called a decannulation cap. It looks like this. All right. It's just this small cap that can go on the end of your tracheostomy tube. A lot of times these are used when you're trying to decannulate, when you're trying to get rid of the tracheostomy tube, you're trying to just learn how to use your upper airways, and they're placed on the end of the tracheostomy tube. These are included in some tracheostomy tubes. The Bivona, for example, has these included with the tracheostomy tube. Unfortunately, the Shiley tracheostomy tubes, they do not include these. So if you need a decannulation cap, you're going to have to try to get one through your medical equipment company. Perhaps your doctor's office has one. The other thing with these caps is some people use them if they just have a tracheostomy tube and they don't need to use it during the day. There are people that just go on the ventilator at night and they're able to cap during the day. So this is what it looks like. Just like this. And you say, why do you do this? Because then you can talk and you use your upper airways without using the tracheostomy tube. Some people are able to do this during the day, but then at night, when they go to sleep, they have to switch over to the ventilator. So these are important. I also always carry one with me. Why? I don't want to say I have a lot of anxiety, but this is a fear of mine. So I do have a fear that I'm somewhere and that for whatever reason, like heaven forbid your car drives off the bridge or something and goes into a waterway or something, I always have one of these handy. And I know you're thinking, well, that's not going to be very logical. If you're in a car accident, you're not going to find it. I know, but I still keep one of these with me, because if you're in some sort of water situation, some sort of water crisis where there's water, your tracheostomy tube is just going to drown you. So I always actually have one of these with me wherever I go. I have it in my ventilator bag just in case. And if I'm actually around water for whatever reason, if I happen to be near a lake, on a lake, I will have this in my hand just in case, heaven forbid, somebody pushes me off, and I can just quick disconnect from my ventilator and throw this on, and it'll prevent me from getting water into my airway. And you say, well, you won't be able to breathe. Well, yeah, I'll be underwater. Of course, I'm not going to be able to breathe, but at least water is not going into my airway. So that's just kind of a quirky thing I do, but this is called a decannulation cap. And I really recommend everybody that has a tracheostomy tube to have one of these, because you never know. Never know. With having a tracheostomy tube, I highly recommend everybody having an ambu bag or a resuscitation bag. This is what an ambu bag looks like. So it might have this mask on. The mask might be helpful, perhaps, if you just want to resuscitate the person via mouth. But it also can detach right here. Oh. And now this can connect to your tracheostomy tube. Boy, I'm getting tired. Okay. And now you say, why do I care? So this will manually ventilate the patient. Really, really important if you have a tracheostomy tube. Why? Because if for whatever reason the person stops breathing, you're going to need to manually ventilate them. Having the mask, doing stuff via mask, it's better than nothing, but really you should attach it to the tracheostomy tube. This is really life-saving for people with tracheostomy tubes. If you have a ventilator, I'm going to say, yes, you should still have one, but the likelihood you're going to use it, much less. Why? Because you have a ventilator, the ventilator is pushing air in and out of your airways. So I do have one of these, but I'm going to tell you a secret. I really don't ever have it handy. I have it in my closet, so I don't keep it on hand that much. But if you have a tracheostomy tube, yes, keep this handy all the time, because you never know if the person might stop breathing for whatever reason, and you're going to need to resuscitate them using the resuscitation bag. Really handy and really essential to keep this with you wherever you go if you have a tracheostomy tube. If you have a ventilator, you might want to keep this with you at all times. If you have a cuffed tracheostomy tube, you're also going to want a syringe. The syringe is going to be needed to inflate and deflate the cuff on the tracheostomy tube. If you have a cuff on your tracheostomy tube, you should probably already have a syringe, but make sure before going home, either from the hospital, from the long-term care facility, wherever you're going, you have a syringe with you. I always carry multiple syringes with me. I put one in my ventilator bag. I usually have one in my jacket pocket. I have these all over the place, and it's kind of funny because I'm like, where did that syringe go? I don't know. So I get another syringe, and I end up having a collection of syringes, which I guess is okay because I have a cuffed tracheostomy tube. So that pretty much concludes everything for a tracheostomy tube. If you have a ventilator, or if you have a tracheostomy tube and ventilator, there are some other things you're going to need. For example, you're going to need the ventilator tubing circuit. This can come in two different forms. So this is just the dry circuit. It's just tubing, just like the one I showed you here. This one does not connect to the heated humidifier. It's just tubing. There are no wires inside. The other one you may use if you're using a heated humidifier. This is the other one. It's more fancy. You can see here that it has a place for the heated humidifier to plug in. Inside there are wires. I don't know if you can see that. Maybe not. There are wires inside, so the wires heat up. So this is a heated wire system. So if you're using a water chamber, you're going to have two tubings. One goes from your ventilator to the water chamber. This one goes from the water chamber to you. So you're going to need 2 pieces. So if you have a tracheostomy tube and ventilator, you're probably going to have 2 different types of circuits you're going to use, and you're going to need both of them. Why? Because when you go on the road, when you go in your car, I just disconnect from my heated humidifier and just use this tubing circuit because it's just much easier than trying to deal with a heated humidifier in the car. Plus, heated humidifiers need electricity, and generally I don't have electricity in the car. The next thing you're going to need with your ventilator are the water chambers. These are the water chambers used for your heated humidifier. This is what it looks like. These just pop off. Well, somewhere I had one that had this off, but it's a mess here, so just pretend. So these pop off. This is just a water chamber. It sits on your water chamber. You're going to want an extra one of these, at least one of these. Some heated humidifiers are actually integrated into the ventilator. So if that's the case, you're going to need that special water chamber that's integrated into your ventilator. The other thing you're going to need are these air filters. So this is the air filter. I'm going to show you. These come in different sizes and different shapes. So you can see ones like this, ones like this. I show you these because in a previous video, I think I showed this one and someone was concerned because I had one like this and they're like, oh no, it's the wrong one. No, these are just air filters. They go on the end of your ventilator. These help get rid of the particles that might be in the air. And I was told with my ventilator, because it actually has an additional filter in the back, that it doesn't need these. So your ventilator might have an additional filter in the back. It might look like something like this. There's various filters. You're also going to need additional filters if they allow you to leave you some. Otherwise, they might just change it every time they come. Your respiratory therapist should do that. But I was told, hey, those filters get rid of everything. Well, look at this. I don't know if you can see that well. This filter is really dirty. I'll show you a clean one. Can you see the difference? Yeah, I was told I didn't need to use these filters. I think the air is still kind of dirty though. So I still use these air filters. These are just general air filters. They get rid of anything that's in the air. And these are really, I find these really important in the hospital. It gives me a little bit of peace of mind that this has helped filtering the air that's in the hospital. So that's another thing you're going to want. Another thing you might want is a carrying case for your ventilator. So your carrying case can come in all shapes and forms. This is one carrying case that I have. This has an extra area for storage here. And then your ventilator goes inside here. So a carrying case is really convenient because it has a strap. You can put it on your shoulder, you can put it on your lap and just at least hold on to this. Some people don't use carrying cases, so that's up to you. But if you think you might want one, ask your medical equipment company about that because very likely they do have carrying cases for your ventilator. Another thing, which is really, really essential, especially if you have a ventilator with a separate heated humidifier, is getting a ventilator cart or a ventilator stand. This will allow you to sit the ventilator and the heated humidifier. It'll allow you to have those all in one. You can just push the stand wherever you need to go, or if you're in a wheelchair, you can just kind of push it wherever you want to go. You can push the ventilator and the heated humidifier. Makes life so much easier. Also, if you don't have this, you're going to try to have to set this up on a nightstand. It's just a lot of equipment to deal with. So ask about getting a ventilator cart or a ventilator stand. Makes life a lot easier. Some people like to take the carts with them to doctor's appointments. Unfortunately, our car is not big enough to do that, and it's really heavy to carry, so I just take everything off and go to an appointment without my ventilator cart. Lastly, if you have a heated humidifier, you're going to want sterile water, or just you're going to get distilled water. Sterile water, distilled water, it doesn't matter for your heated humidifier, but please use one of the two. Some medical equipment companies do provide sterile water. Hip, hip, hooray! Some don't. Which means you're going to have to get it from the grocery store or wherever you get your distilled water. So you're going to need that. So that's just another thing. When you're coming home, make sure you have distilled water or sterile water handy. if you're coming directly home from your procedure, I would ask the hospital, I don't have any distilled water or sterile water. Can I take a bottle or two with me? This just will give you some peace of mind that you have some water with you. And if you don't remember on your way home to get some distilled water, or if your medical equipment company doesn't carry it, distilled or sterile water, then you have some just on hand for at least the first day or two. It's helpful, and a lot of times the hospital will say, yeah, you can have a couple bottles. It's not a big deal. So those are some of the things you're going to need if you have a tracheostomy tube and a tracheostomy tube and ventilator, or just a ventilator. I know it can be a bit overwhelming, but those are some of the supplies you're going to want, you're going to need. It's going to be helpful. It's a lot to take in, but just work through it little by little. Do you have this? Do you have that? And sort through it with either your respiratory therapist or your medical equipment company. And please run this through them. If you're being discharged directly from the hospital, run this all with them before being discharged to make sure you have everything set up when you get home, because there's nothing more frightening and terrifying than arriving home and you're like, oh, I don't have suction catheters, or I don't have this. And if there is something you don't have, please feel free to ask the hospital, I don't have this, or I don't have that. Can I have one or two of those? And a lot of times they will more than likely send you home with one or two, so you have them on hand. The other thing I want to say is if you're getting discharged from a long-term care facility, you won't necessarily have access to extra supplies. So if you're being discharged from a long-term care facility, please make sure that the medical equipment company or the respiratory therapist is providing with all this equipment before going home, because I've heard stories where they promise they're going to deliver things and they forget. So just make sure you insist. When I got discharged from the hospital, they actually came to my hospital room and delivered everything to my hospital room. It was unbelievable, like everything I had to take with me. But I am so grateful they did that, because my family came, they took it into their car, they brought it home. So I had everything. As soon as I was discharged, I had all my medical equipment, and it was just such a peace of mind. So I encourage you, if you're a long-term care facility, if you're getting discharged from a hospital, wherever you are, please insist that you get your medical equipment before you actually leave the facility, so you know what you have. You can plan, if they're not going to provide something, you can plan to maybe stop at the store on the way home to pick it up, get somebody from your family or friends to pick that up for you. And so you're all set when you come home and you're able to take on your new life with a tracheostomy tube and or ventilator. So thank you so much for joining me. Please remember to like and subscribe down below. Please also remember to comment and share. It really helps my YouTube channel. Also, if you have any specific questions or concerns, leave them in the comments, leave them on Facebook, send me an email. I'll be more than happy to try to answer them. And if you have any suggestions about things I forgot in this video, because I'm sure I probably did, please leave them down in the comments so other people can read them and understand things that I might have omitted in this video. So I hope you have a great day and a wonderful week. Bye.